Some pregnant women experience an increased desire for intimacy during pregnancy. For others, the desire becomes very low. But for men, their partner being pregnant usually doesn't change their sexual desire because their bodies don't go through any major changes. Their normal biological needs can still remain active. This sometimes leads to misunderstandings, conflicts, or even issues like extramarital affairs. That's why every pregnant woman should know whether sex is safe during pregnancy, whether it can cause any harm, and in which situations sex should be avoided. Hello, mommies, daddies, and all my lovely viewers. I request everyone who is new to this channel to please subscribe and click the bell icon set to all so you never miss our helpful videos regarding mother and baby health. Now, let's get into today's main topic. Many people say that sex during the first 3 months and the last 3 months of pregnancy is unsafe, but this is not true. Sex during pregnancy is completely safe, not just during the first or last trimester, but throughout the entire pregnancy, as long as you follow certain guidelines. If your pregnancy is normal, if you don't have any specific medical complications, and your doctor has not advised against sex, then sex is completely safe and risk-free. There is no chance of harming the baby. However, many pregnant women lose the desire for sex, or their desires change. This is perfectly normal and nothing to worry about. Share your feelings with your partner and work things out through mutual understanding. You might wonder, does sex harm the baby in any way? If your pregnancy is normal and complication-free, sex does not cause miscarriages or premature labor. Toward the end of pregnancy, sex may cause mild uterine contractions. Your uterus might feel tight or crampy. These are called Braxton Hicks contractions. They may feel uncomfortable, but they are not actual labor pains. They come and go on their own. These contractions can also occur later in pregnancy due to many other normal reasons. They simply indicate that your delivery date is getting closer. Stay relaxed, drink small amounts of water, and rest. Normal movements during sex do not harm the baby. The baby is safely protected inside the amniotic sac and surrounded by strong uterine muscles. The cervix is sealed with a mucus plug, which protects the baby from infections. The penis only enters the vagina and can never reach the baby, so there is absolutely no risk of harming the baby. During orgasm, you might feel mild cramps or tightening. This is normal and temporary. But there are specific situations when sex should be avoided. If you have had any light, moderate, or heavy vaginal bleeding, if your cervix is weak or partially opened, if your cervix has been stitched, cervical cerclage, if your mucus plug keeps coming out, if you have placenta previa, placenta lying low, if your water has broken before labor, if your doctor has put you on bed rest, if you are carrying twins, triplets, or more multiples. In these cases, sex must be avoided, and the husband should also understand the seriousness of these conditions. Many ask, what is the safest position during pregnancy? The most ideal position is the missionary position, where the wife lies on her back and the husband stays on top, as long as there is no pressure on the woman's stomach. Side-lying positions, or positioning with pillows for support, are also safe. Whatever the position, make sure no pressure is applied to the belly. If needed, the husband should avoid full penetration. Men may ejaculate inside. This is not harmful. But one thing is important. If the husband has any sexually transmitted infection or STI, he must use protection. Otherwise, the wife and baby may be at risk. So viewers, these were some important guidelines about sex during pregnancy. I hope today's video was helpful and informative. Please share it with others so everyone can learn these important facts. That's all for today. Stay well, stay healthy. Goodbye and take care.